So this is a presentation of lateral epicondylitis by Darwin Hurst, Frontier Nursing University. My elbow hurts when I move my arm. Subjective data, history of past illnesses. This is Calvin Smith, date of birth 7/8/83. He's a 33-year-old white male who presents with right elbow pain, and he woke with pain on the outside of his elbow 3 weeks ago after unloading a truck full of cement blocks. He works as a mason, and his pain is increased, especially when working with a trowel and gripping bricks, aching with easy movement, sharp with exertion. He has taken Tylenol 500 milligrams for every 4 to 6 hours with minimal relief, and now he has a constant 6 to 7 out of 10 pain at work and with simple movements at home. He denies a history of gout or trauma or falls to the elbow. History: he's healthy, well-developed 33-year-old man. He's hospitalized in 2010 for an uncomplicated appendectomy, and then had a sinus infection in 2013 resolved with antibiotics. No chronic illnesses. Denies any problems with mood disorder. He does not have a current primary care provider. He had routine visits to a pediatrician until he was 18. Immunizations are unsure if they're current. He did go to community college, and they were current when he went to community college up till age 18 or 19 when he was in college. Family history: father is alive. He does have hypertension. Mother's alive with fibromyalgia and arthritis, and sister is alive and well with no medical problems. So his social life: he's married, has 2 children, 7 and 4, and he works as a mason, as stated. He does smoke a half pack a day, and for about 12 years. He does drink about 1 beer a day and a little more than that on the weekends. Denies any drug use. Has a rash, a penicillin allergy, and gets a rash. And as stated earlier, he does take Tylenol 500 milligrams every 4. So review of systems: reports good health, no fevers or weight gain or loss. Cardiac, no problem with chest pain or palpitations, no shortness of breath in his lungs, wheezing or cough. Musculoskeletal: he denies joint pain or tenderness except in the right elbow, and indicates the pain is with movement of his right arm and lateral aspect of his elbow. He denies other range of motion difficulties, and he denies numbness or tingling in those extremities. On that right arm, he doesn't have any numbness or tingling, and anywhere else for that matter, but there in particular. In TEG, no rashes or suspicious. Exam, objective. I will not read the vital signs, but he did not have a temp. Height 5'8", 183, so he's got a BMI of 27.8, so he's a little bit overweight. Generally, he's alert and oriented, well-developed, appears in no acute distress, no apparent distress, excuse me. Normal sinus rhythm, S1 and S2 is good. Listen to his heart, listen to his lungs. Lungs were good, lungs were clear. Skin, I observed no rashes. There were some, or lacerations. There were a couple minor work-related abrasions on his hands, but none appeared infected. Lymphatics, no cervical or axillary adenopathy, and normal sensation and motor exam of his fingers. The important part here is that he had no deformities. He did show good range of motion with that extremity, except for some resistance to full extension on his right elbow, and then also with resistance on his right wrist. He did have a little bit of pain, and just with simple movements, he showed some pain. No neck or back range of motion limitations, and no injuries to his neck that would sort of radiate down into that arm, which might cause that kind of pain. Pain's localized to that lateral epicondyle with palpation, so that point tenderness right on the outside of his elbow. And if you lay your hand palm down on the desk or on a flat surface and try and lift your third finger, your middle finger, up, that will often produce pain with lateral epicondylitis, and indeed it did. And also with resisted forearm supination, so you can roll that palm upward from a downward facing position with resistance, that also causes pain. Gripping a chair and trying to lift it, or brick as he does, and lifting with palm down also causes pain. Those are all positive signs for lateral epicondylitis, and he has those. No swelling or heat noted over that lateral epicondyle on the other hand, though. Assessment, differential diagnosis for him: medial epicondylitis, perhaps trauma, contusion. Doesn't have any of that. Denies any of that. No, nothing obvious there. Olecranian bursitis, doesn't appear to be any fluid on that. Osteoarthritis, well, his mom has a history of arthritis. This was sudden onset, and then infection. Again, no. So his diagnosis is lateral epicondylitis, otherwise known as elbow. Definition of that is acute or chronic tendon injury from micro tearing in the extensor tendon. So it's repetitive use of that extensor tendon, which can include flexion of the wrist, especially downward facing, or supination, that's twisting of that hand or forearm. And those micro tears can cause, in that tendon, the extensor tendon, can cause inflammation. And it's sort of a healing, re-injury, healing, re-injury type of cycle that creates injury. Angiofibroblastic degeneration, which means in the tendon there's decreased blood flow, the tendon fibers are breaking, micro tears, you're going to have increased pain, and then you're going to have that longer healing time as those tendons stated earlier try to heal but are re-injured again and again. And of course, tendons which don't have great blood flow to begin with, as this process and inflammation continues, you can have reduced blood flow. Risk factors for him: repetitive wrist extension. As you see a bricklayer on the picture, that's kind of that downward facing, palms down, and also using of the wrist with the trowel. Manual laborers often are susceptible to tennis elbow. Repetitive tasks, keyboarding can also cause lateral epicondylitis. Age seems to be the most prevalent, is 35 to 55. And smoking can also be a risk factor. He is a smoker there. And then tennis players, when they do the backhand or the backstroke, they are susceptible because it puts a lot of force on the extensor tendon. So the common symptoms you're going to see are tenderness observed over that anterior and distal or lateral epicondyle. So right on this picture, you see the man kind of pointing to that area. You're going to have some of that point tenderness right on that tendon, and they'll be able to locate that again with extension of that third finger, resisted extension, or supination of that hand or forearm. You're going to feel that, or the chair, painful gripping, reduced strength in the grip. And for him is, I'm going to start him on medications. The only medications are going to be NSAIDs. I'm going to write a prescription for ibuprofen 600s. It's easier to take than a bunch of 200s all the time. So 600s, Q 6 to 8 hours times 14 days for pain. And then activity-wise, I want him to limit the pain-provoking activities. So be careful with what he does with the palm down activity. Slow stretching. I'm going to refer him also to physical therapy for treatment, and also teaching for home exercise that he can do, which is also sort of these resistance exercises, which have proven effective both in the short term but also for long-term outcomes. We want to do the exercise just to the point of where we would have any more micro tearing. So we're just trying to get up to the point where we're working that tendon but not overworking it. And then bracing can be helpful. Putting a brace on the wrist can be has moderate of efficacy, has shown to be okay, but it can also just limit the motion of the wrist. Plan continued. We will not be doing any radiography for him. His is acute, and it's less than 4 weeks, and also he's not had treatment for 4 weeks. So we're going to try that first, at least 4 weeks. And he's not had any trauma. Steroid injections, we're not going to be doing that either. We're going to rule that out just because he's not, those are associated with poor long-term outcomes. They are good for the short term, but they do not help in the long term, it is shown, not as much. No laboratory test or indication. Mild resistant exercises may be helpful in accelerating healing, so I'm going to tell him do those exercises. Ibuprofen helps with pain. It's going to reduce the inflammation, but you can't take more than 2,400 a day. Use it for 14 days, and then see where you're at. You can take that with food and watch for signs and symptoms of GI upset or bleeding. So avoid the aggravating activity for 14 days. and then follow up with PT after this appointment and begin home treatments. Can be helpful. It's not the main therapy. It does have limited benefits, but you can try it. Helps reduce some of the inflammation if there is some there. Not always a process according to the literature. Smoking increases healing time, so I'm going to tell him smoking cessation and education and consultation for him in the office that day. Brace on the wrist can be prednisone is an injection. If he asks about it, worse with long-term outcomes. Let's not do that today. Patience is needed. This is a long-term recovery. It takes a while for everybody. It doesn't happen quickly. It doesn't happen over a week. Often pain will resolve in about a year for about everybody, for 90% are the figures. Acupuncture can be helpful in the short term. Again, not super strong evidence for that. If I suspect any RA or fractures, if I palpate any masses, or if we do find any adenopathy, that might be a signal. And just trying to rule out any other causes. Refer if conservative treatment does fail after about 8 months. Seems to be what the literature says. MRI, ultrasound, X-ray. Then options are surgery. Low-level laser therapy are options, but they're not. That one does not seem to be excuse me, that does seem to be fairly effective. And then extracorporeal shockwave therapy also seems to not be as effective, but it is an option. And then prolotherapy. So health promotion, I wanted to stop smoking, so help him move towards that. Maybe some weight loss for him. Body mechanics, being careful how you move, keeping things close to your body, not putting that extra stress as you hold your hands far out from you. Caution with aggravating activities like bricklaying, unfortunately, but that's something he's going to have to be careful with. And then reduction in ETOH simply could be helpful for some weight loss as well. Reassess him in about 4 to 6 weeks. If there's no improvement, after about 8 weeks, we may consider radiography. That would be at the earliest. Begin alternate therapies. We could consider some other things. Those things are not inexpensive, and they're not always covered by insurance. So we would want to try conservative therapy as long as we can if he's being compliant. And speaking of that, monitor PT or home exercise compliance. Reinforces that healing time. Slow, but you can see small improvements, and that is indeed healing. So we're not going to see a quick turnaround. And then assess GI and monitor his NSAID use with him doing that. So on those medications, ibuprofen. Rest, treatment guidelines are rest, limit aggravating activities. NSAIDs are great, or NSAIDs are good, a good analgesic. They're a good choice. They're not the be-all, end-all, but they can help people. Resistance exercises are proven to be good. So PT referral, and then doing those exercises at home where he doesn't have to go to PT all the time. He can do some things by himself. You wear a brace. That can be helpful, good reminder. And then no radiography is indicated. Again, expensive and not really indicated. I would write a prescription for him for ibuprofen, 600 milligrams, 1 tab PO, Q6 to 8 hours times 14 days for pain. No refills on that. I'd like him to taper down on that. If he does need to continue on ibuprofen, I would like it to be less than that amount daily. Lateral epicondylitis treatment, teaching home exercise program. So 30 minutes for the PT every week for 4 weeks to teach him what he can do at home. This ends my maybe you want to look at that. This ends my slideshow presentation, and I thank you for watching this.